Hello, this is Dr. Yusuf presenting you to a case of explantation of a single piece acrylic lens to be replaced with another one that's acrylic but doesn't have astigmatism correction. The ZCT225 was picked because the patient has astigmatism preoperatively, but it actually was caused by a small chalazion. So when this chalazion is resolved, the astigmatism is gone, so we extend the lens. We're using the same incision we used to implant the lens to do the cataract, and then we're going to use the same incision to remove the lens. The lens is dissected out of the capsular bag using Lester hook. The viscoelastic is used to protect the cornea from the front and back and capsule, and then the haptic will be positioned against the wound so that it will be pulled out first, and then the optic will be pulled out next. So now the haptic is positioned at the wound, so it is easier for the tooth forceps to pick it up and pull it out, and then pull out the optic. So the haptic is externalized. Okay, no counter traction and no counter manipulation from the other wound is needed. Now the tooth forceps 0.12 is pushed through the wound and pulled with the lens in it. You have to make sure that this is a slow motion the same part. Grip really hard, avoid twisting the lens. Make sure that you pick a good one with the teeth intact, because it has 3 teeth, and you have to make sure that all of them are intact. This is how they should look like. So not in the OR we have some of them that are missing teeth, so make sure that you pick the one with the good teeth. Now the rest of the procedure is continuing the same way. In normal fashion, the intraocular lens is implanted through the same wound, and the wound is not made any bigger by this process, and there's no surgical induced astigmatism more than the normal for these cases. So the astigmatism for this patient is resolved. That was caused by the toric lens, and no extra astigmatism caused by the procedure itself. The cornea is protected, no damage. The whole procedure took 4 minutes. Of course, I made this video a little bit faster to not to bore you to death. And it's all 4 minutes. And this is the hydration of the wounds. No need to suture the wounds because the wounds is intact, and I use the dropless injection. This is hydration with moxifloxacin, and the injection with the dropless using triamcinolone and moxifloxacin. Thank you for watching. Please use this technique rather than cutting the lenses and damaging the corneas. Thank you for watching.